Hello everyone, I'm Dr. Kanchan Patil, Clinical Lead for Central Pre-Op Assessment Unit here at St. George's Hospital. I will take you through our new POA transformation project, ASA1 streaming. What is an ASA1 patient? The ASA classification is used to assess and communicate a patient's pre-anesthetic comorbidities. By assessing this, we can then gauge potential complication we may encounter during a surgery. An ASA1 patient is a healthy, non-smoking, BMI less than 30 patient with no or minimum alcohol use. Our Tableau data shows that 35% of St. George's Hospital surgeries take place on ASA1 patients. Currently, most of these patients undergo the following POA steps. First, a nurse-led pre-appointment either over the phone or face-to-face, and the second step, an HCA or a near patient assessment appointment face-to-face. There is no benefit of these otherwise fit and well patients being inconvenienced by this process, especially when they are coming for a non-major surgery. As you can see below, there are 16 questions set out to assist clinical teams to quickly and accurately identify which patients are ASA1 and which are not. For the below questions, if the answer to all of the below questions is no, the patient is an ASA1. If the answer to any of the below question is yes, the patient is not an ASA1. We are in a process of putting the posters of this questionnaire in each surgical area. Meanwhile, feel free to take a photo of this questionnaire for future reference. From Monday, November 14th, referring surgeons will be able to specify whether patients are ASA1 using a new questions on the ETCI.
So what I'm going to do is I'm going to place an order for an operation to occur while I'm in clinic. So I'm going to go to add. And then I'm going to place an order. So to complete our order information, the yellow box is on mandatory. So we're going to fill in all of this information with the details of the responsible clinician. And we're going to work our way down the field. As we scroll through, you can see on here that this question asks the ASA1 grade, and this is a new feature that's been added on to the ETCI request to allow us to do what we call ASA1 streaming. So I'm going to decide on whether this patient is an ASA1 grade or not. And ASA1 generally means that they're fit and well and they're healthy with no medical history and they aren't on any medication. So I'm going to say yes, they are ASA1. I will then carry on completing this field. So this is a day case waiting. I am not expecting this patient to go to ITU, so I'm just going to complete the rest of this information that I think is relevant for the procedure, and I'm going to sign it. Now once I've done that, this is already submitted into the system.
Please note the ASA1 question on the new ETCI is a mandatory field. Please remember, if in doubt, tick no and the patient will be screened through the existing or standard POA processes. The process of PPCs will change slightly for the patient listed for surgery prior to the launch of the new ETCI.
I will right click and go to schedule. As you can see, the order information appears and I'm going to tick OK. But as you notice, when I've done that, because of the new ASA1 field that's been added to the ETCI, an validation error comes up and it tells me that there's information within here that hasn't been completed. So it will take me straight to the ASA1. And on this bit, the answer will be no or yes. For it is best done with clinical advisement. So if you have your clinician in the room with you or are easily accessible, then you're going to ask them whether they feel that the patient will be an ASA1 or not, and you will then record yes or no. If there is any doubt and there are delays getting this patient scheduled for theatre, you're going to write no, and the patient will then be streamed into the current process for preoperative assessment. So I'm going to say no because I'm not certain, and then I will then save, and my scheduling list will then come up for me to schedule this patient in to have surgery.